Communities like Flint who lack the access for the MCED testing, the impact would be tremendous. Testing for my community for cancer would save lives. Ultimately, that's what the goal is. We want early detection. We want to find out if somebody is susceptible to certain cancers, and we want to save lives. That's what we ultimately want to do, and I think that's what this testing would allow. I come from a community that is struggling on so many different levels. And unfortunately, due to the water that still is not clean after 10 years, the cancer rates have risen tremendously. Just an example, I worked for the Make-A-Wish Foundation. I should say volunteered for the Make-A-Wish Foundation. I unfortunately had a wish baby who passed away from 3 different cancers before we could grant her wish, on the day before we were supposed to grant her wish. So we're losing children, we're losing elderly, and we're losing young people who would be, I think we could save their lives. We can get them the treatment they need if we get this MCED testing in our community. I think to make the testing possible, Medicaid has to be expanded. The community I know of best and I come from, the resources are limited, especially financial resources. And these tests, I'm sure, aren't cheap. So we need to expand Medicaid and Medicare to make sure the people who need the testing have access to it. Without it, I don't know if that would even be possible. The community I come from, we justifiably struggle with trust. It has been displayed, it has been demonstrated that nobody really cares about Flint. We have people that come in who have gotten opportunities to get, I want to say, wealthy, rich, expand their financial portfolios, but nobody's really impacting the people the way they need to be impacted. We need people to come in who really have good intentions. And I think coming in, most people are not going to trust them. We have to see that you're going to be a person of your word, that you're a person of integrity, and you're somebody who really cares about the city and the people and want to make a difference in the community. And until we see that, the distrust is still going to be there. It's not going to go anywhere. The way that MCED can restore or gain trust is by showing and proving. And how you can do that is to just don't turn your back on the city. The misinformation about the water being clean is I think a lot of people think the water is clean, therefore they don't understand the cancer crisis that's affecting the city right now. They don't understand that people are dying for 5 different cancers. They don't quite understand why and how it could be that we are not being diagnosed properly, or we don't have access to certain things because we were in a crisis, or we are in a crisis still after 10 years. So in order for us to trust MCED and the testing, you have to stay and you have to fight the good fight, because it's a fight. You would think that it would be embraced, that you're coming into a community to try to help and do better, if that's initially or in what you really intend to do. But to do that, you have to fight the good fight, because it's going to be a fight in order to get the testing to the people so they can trust you. When you got elected officials who don't have good intentions for the city or the community, it's a fight. As a former elected official, it's absolutely a fight. And we need to know that you're going to be there and fight with us.